guys, today I'm back with another video where I'm going to talk about your question that why my child on a spectrum is putting everything in the mouth, playing with the saliva or eating or chewing the t-shirt or the collar of the shirt. So, my dear parents, first I will try to explain what is self-regulation, and if the child is not able to self-regulate, again these kind of sensory processing difficulties comes in the form of mouthing. So, my dear parents, first I will try to explain you in a very simple manner that whenever sensory processing difficulties are there in your child on spectrum, then the central nervous system is not able to send the proper sensation to your kid's mouth. And when the proper sensation is not there, then your child starts searching for the additional sensory input inside the mouth in the form of behavior which is called as mouthing, sometimes playing with saliva or chewing on the t-shirt. Now, I'm going to explain you the different reason of mouthing, playing with saliva or chewing the t-shirt. The first thing, it could be a developmental delay. You know why? Because till the age of 18 to 24 months, mouthing is normal. So if your child is showing mouthing, it is because of the developmental delay in comparison to your kid's actual age. Second thing, sometimes there are different dental problems. So I would like to request you, please check with your dentist that everything is okay there. Sometimes there are medical condition in the form of pica. So where the kid like or prefer to eat different non-food objects or non-foodie items. Sometimes there is a sensory overload which is not related to oral sensory issue, but the sensory load, it could be different. The child gets overwhelmed with sound, light, movements. So to avoid or escape that sensory overload, the child uses different kind of proprioceptive input. Proprioception is basically the feedback from different kind of muscles and joint all over the body. But here the chewing the child shows is very important because it is one of the strongest muscle which is there, called as the jaw muscle. So it provides a very calming and organizing input to the brain of our kid, and thus the child starts showing the behavior of mouthing just to calm himself, organize himself, to avoid the sensory overload, and thus decreasing the need to seek the additional sensory input from the mouth. What are the different strategies which occupational therapists could use or help the parent to use at home? For this, again, I would like to ask you that please first of all explore the pattern where the child is doing mouthing more. Is it during the morning hours, afternoon or evening, before taking food or after taking meal? Sometimes the child shows mouthing behavior in front of some specific person, or at home or at school. Sometimes there are different overwhelmed kind of sound and light where the child shows mouthing. So we need to explore and catch that pattern, whether the child is overwhelmed in that particular environment, and that could be the reason, that is the pattern where the child is showing mouthing. So once you catch that particular pattern, then it becomes really very easy to understand the need of my kid. So if we can break that pattern and provide heavy work activities before involving the kid into that particular event which is actually stressful for your child, the child becomes anxious or sensorily overload. So if we provide the heavy work activities before that sensory stimulus or before that task or before that environment, then what we are doing is we are providing the calming strategy to your child so that the brain is becoming calm and organized. Now, after doing this kind of heavy work activities, your child is able to perform that particular event or task for which he was showing overwhelmness, he was showing anxiety, he was showing escaping behavior, and which increases his mouthing seeking behavior. So it's becoming a bit complicated. I'll try to explain this by giving you a very simple example. For example, Mama wants my kid to sit and do some handwriting stuff. Now, my child is not ready to sit, first thing, and second thing is doesn't want to write anything. So now, this is a stressful situation for your child. Your child will become overwhelmed with this environment to get onto the chair to sit and to do the handwriting. Now, to break this pattern or event, if you provide heavy work activities, proprioceptive input, which will help him to calm, so then the child will not show that much of mouthing or playing with saliva or chewing over the t-shirt in comparison to what he was showing before, because he was overwhelmed with this event or situation of sitting and doing the handwriting. Now, what are the different strategies used by occupational therapists to help the parents as well as kid to decrease this mouthing or oral seeking, sensory seeking behavior, chewing on the t-shirt or playing with the saliva? Because all these behaviors are either tactile seeking or proprioceptive seeking. If it is tactile seeking, then we can use different kind of sensory activities in the form of playing with water, watercolors, playing in sand, pebbles, different kind of wet toys, wet textures at home, at school, or during the therapy sessions. Second is, if it is proprioceptive seeking, as I have mentioned earlier, the chewing is really a very big hit proprioceptive feedback of our body. So the jaw muscles, these muscles are very strong muscles of the body, and they provide a very strong proprioceptive feedback to our brain to get calmed down and to organize. So that is the reason the child used chewing. So what are the different proprioceptive activities we can give to our kid is heavy work muscle activities in the form of crawling, in the form of animal walk. Then we can give different kind of sugarless candies and hard candies, so that it will again give the additional sensory input to our kid. So the important thing is additional sensory input which is to be provided to your kid either through the whole body or through the mouth. We can use full body massage, we can use oral massage in the form of circular motions, we can use vibratory toothbrush, which again provide the additional sensory input inside the mouth. We can provide different resistive sucking. For example, if your child likes smoothie, so when we use a straw to drink that smoothie, we need a bit thick diameter straw, but in your case you give a thin diameter straw. So when the child will suck smoothie, he needs to put lots of resistance, means again additional sensory input or additional pressure, proprioceptive input to calm your child. We can use musical instrument, for example harmonica, which again gives additional sensory input. We can use carrot sticks to chew. We can give nuts, we can give crunchy muesli to your kid. And then there are different chewing jewelries, so the child can just wear it like a necklace, and whenever the kid require to have a additional sensory input, the child can chew over it. So my dear parents, I hope now you are able to understand why the child on a spectrum is showing the behavior in the form of mouthing, um, playing with saliva, or chewing the t-shirt. So we have to check out the patterns. We have to check out the event transitions where my child is getting overloaded, or it is really that the child is seeking tactile input through the mouth, or proprioceptive input through the mouth or through the whole body. Thank you so much.